Department 13, you're being dispatched to the scene of an ATV accident. Reported 40-year-old female rider, unhelmeted, struck a ditch, flew off the ATV, and is laying unresponsive in the lawn. Family is with her. Department 13 is due.
Proper PPE. Is the scene safe?
The scene is safe.
I see one patient. Are there any others?
There are no other patients.
Were there bystanders?
There is family with the patient.
Okay. I'm thinking C-spine at this time because of mechanism of injury. One female, white, possibly in her 40s. She does not seem to be conscious. Hello, ma'am. My name's Ryder. I'm an EMT. Can you hear me, ma'am? Hello, ma'am. Can you hear me? Not responding to verbal. Going to go ahead and see if she responds to pain. Strong sternal rub. Pinch of the earlobes. Does not respond to pain. She is unconscious and not responsive. Going to go ahead and assess her airway. Airway is open and clear, but because she's unconscious, I'm going to go ahead and insert an OPA. Going to insert it upside down and then rotate it 180 degrees until it sits flat against her lips. Still being conscious of the C-spine, I'm going to go ahead and assess her breathing, making sure that there's no flailed chest. No flailed chest. Chest rise and fall is equal. Her respiration seems to be a bit slow, but they do seem to be adequate. However, at this time, I still recommend applying 15 liters per minute of oxygen via a non-rebreathing mask. Circulation, checking your pulse. Pulse is present and strong. Skin is warm, dry, and pink, checking for any gross bleeding. No gross bleeding, but still going to treat for shock. We're going to elevate her legs 6 inches in the air and apply a blanket to keep her body warm. Now we're going to go ahead, or I believe this is a high priority patient, and this will be a rapid assessment. So I'm going to go ahead and start with her head, feeling the cervical spine, making sure that there's no deformities or step outs, which there aren't. Moving up to the scalp, feeling for any blood. Feeling the bones in her face. Checking her mouth once again. Looking in her nose, in her ears, checking her eyes. Going to move down to her neck, checking if there's any tracheal deviation. There is not. You can see her veins well. They're not distended, no JVD. We're going to go ahead and apply a C-collar at this time with the help from my partner. Moving down to the chest. I'm going to go ahead and palpate for any decab BTLS. Making sure that the sternum is stable. Sternum is stable. I'm going to go ahead and listen. Nothing out of the ordinary there. Moving from the chest down to the abdomen, palpating the abdomen. No decap BTLS. Abdomen is non-tender and soft. Checking the pelvis. Pelvis is stable. Moving down to the lower extremities, palpating for decap BTLS. And checking the pulse. Pulse is present and regular. No sensory and no motor function due to level of consciousness. Moving back up to the upper extremities. Palpating, checking for any decap BTLS. No gross bleeding. Pulse is regular and present. This is a high priority patient, so we're going to go ahead and load her into a backboard and get her into the ambulance after we check her back. Palpating the spine, the thoracic and lumbar. Checking her legs. Negative for decap BTLS in the back. We're going to go ahead and load her onto a long backboard and strap her in and prepare her for transport. Okay, now that we are in the ambulance, we're going to go ahead and take her vitals while my partner is asking the family for a sample history. going to go ahead and start with the blood pressure. Blood pressure is 110/60. We're now going to check her pulse. Respirations is 16 and her pulse is 66. We're now on our way to the hospital.